Second white coat. Subscribe and like. Let's learn medicine together.
You know, in any good mystery, you get these clues that seem totally random, like a hoarse voice, trouble swallowing, maybe a drooping shoulder. But they all end up pointing to one single culprit. Well, today, we're going to solve a real-life neurological case that does exactly that. It's a fascinating one.
So think about it for a second. What on earth connects hoarseness, trouble swallowing, the medical term for that is dysphagia, and a drooping shoulder? I mean, they seem completely unrelated, right? But in neurology, a pattern like this, well, it's like a trail of breadcrumbs, and our job is to follow that trail all the way back to the source.
Okay, so our investigation is going to start with the patient's case file. Let's dig in and see what we've got.
All right, so our patient is a 66-year-old woman, and right off the bat, the first thing we see in our file is a history of lung cancer. Now, you're going to want to file that detail away. It's a huge piece of foreshadowing for later. She comes in with this really strange mix of symptoms, and that's where our detective work really kicks off.
So here are the specific clues the doctors found during the exam. First up, her gag reflex is gone, but only on the left side. Interesting. Second, when she opens her mouth and says, ah, her uvula, that little thing that hangs down in the back, it pulls way over to the right side. And third, her left shoulder is visibly drooping, and it's weak when they test it. Now, these aren't random at all. They're very specific, very precise pieces of the puzzle.
Okay, we've got our clues. So what's the next step in any good investigation? You got to identify your persons of interest, right? Well, in neurology, that means figuring out which cranial nerves are responsible for these actions.
And this is where we start connecting the dots. That loss of gag reflex, that points us straight to the glossopharyngeal nerve, or cranial nerve 9. The hoarseness and that uvula pulling to the side, that's the vagus nerve, cranial nerve 10. And the weak, drooping shoulder, that's a textbook sign of a problem with the accessory nerve, cranial nerve 11. Boom. We've got our three main suspects.
And right here, this is the breakthrough moment. This isn't three different problems happening at once. All of these issues are on the left side of her body. And let me tell you, in neurology, that is almost never, ever a coincidence. It's a massive clue. It's practically screaming at us that there's one single problem in one single spot that's hitting all three of these nerves.
So, what's next? We have to find the crime scene. We need to find the one physical location in the body where these three nerves all travel together. If we can find that spot, we found our lesion.
So just think about the anatomy for a second. The base of the skull is incredibly complex, right? It's got all these little holes and channels for nerves and blood vessels to get through. So the million-dollar question is there a single passageway, some kind of bottleneck, where cranial nerves 9, 10, and 11 are all squeezed together?
And there it is, the jugular foramen. That's our spot. That has to be where the problem is.
So what exactly is the jugular foramen? Well, you can think of it like a tunnel or a canal right at the base of the skull. It's basically the one and only exit ramp that these three specific nerves, 9, 10, and 11, all have to use to get out of the skull and go do their jobs in the throat and the shoulder. So it makes sense, right? If something goes wrong inside that tunnel, it's going to take out all three of them at once.
Okay, so we've pinpointed the location. Now we can finally put a name to the condition and figure out what's causing all this trouble.
This very specific collection of symptoms actually has a name. It's called jugular foramen syndrome, or sometimes Vernet syndrome, and it's defined as, well, a condition caused by a lesion, some kind of abnormal growth or compression right there at the jugular foramen, affecting this exact trio of cranial nerves. It is a perfect one-to-one match for our patient's symptoms.
Now, remember that little detail I told you to file away at the start of the case, the patient's history of lung cancer? Well, here it is. This is the final piece of the puzzle. It turns out her neurological symptoms weren't random in the slightest. They were a direct result of her cancer.
So let's lay out the entire chain of events. It started with the primary lung cancer. That cancer metastasized, which means it spread. A new tumor, a lesion, formed right at the base of her skull, specifically inside the jugular foramen. And that growth started pushing on, compressing, all three of those nerves trying to get through that little tunnel. And that's what directly caused all of her symptoms. It's a perfect, though tragic, sequence of cause and effect.
But hold on. A good detective always has to check their work, right? We have to consider other possibilities before we close the case. Are we 100% positive it's the jugular foramen? I mean, what about other nearby holes or structures in the skull?
Well, this is exactly why we're so sure. Let's look at the other suspects.
If the lesion were at the cerebellopontine angle, you'd almost certainly expect to see hearing loss and facial weakness. Our patient didn't have that. What about the hypoglossal canal? That would cause the tongue to deviate to one side. Nope, not present. And a problem at the foramen magnum? That would cause huge problems like weakness on both sides of the body. Again, we don't see that here. None of these other locations fit the evidence. Only the jugular foramen explains the symptoms we see and, just as importantly, it explains the symptoms we don't see.
So, there you have it. Case solved. But what's the big picture here? What's the key clinical takeaway from this whole investigation?
This is the absolute core lesson. Neurology isn't just about memorizing a bunch of random facts. It's all about recognizing patterns. And the pattern is this. When you see this specific cluster of symptoms, your brain should immediately go click and jump to one and only one anatomical location, the jugular foramen.
And here's that pattern laid out nice and clear. For anyone studying medicine, this is pure gold for your exams. Listen up. Hoarseness, difficulty swallowing, no gag reflex, a uvula that points away from the bad side, and a shoulder drop on the same side. You see that cluster, you think jugular foramen syndrome. Simple as that.
Really, what this whole case shows us is the incredible power of anatomical localization. It's a foundational principle in all of neurology. If you know the map of the nervous system, you can take what looks like a totally chaotic list of symptoms and trace them all back to one single logical starting point.
And that really leaves us with a final thought. This whole idea of thinking where doesn't just apply to this one specific syndrome. It's a fundamental concept that runs through all of neurology. So the question I want to leave you with is this. What other neurological puzzles can be solved not by asking what is wrong, but just by asking where?